Potassium is absolutely important for all living cells because a lot of important physiological functions depend on potassium, like energy generation and generation of action potential. Without action potential, we cannot move because our skeletal muscles cannot contract, our heart cannot pump because our heart cannot contract, and our peristalsis can slow down so that we can develop constipation. We would know more about the signs of low potassium level as the video progresses, but right now I want to tell you that we require around 2500 to 3500 milligrams of potassium every day, but it heavily depends on our body weight. The children would require slightly lower amount of potassium, whereas an adult like me would require somewhere around 3500 milligrams of potassium every day. Also, the kidney failure patients may require lower amount of potassium than the normal person. The medical term for low potassium level is called hypokalemia, and the normal potassium level is between 3.5 millimole per liter to 5 millimole per liter. Anything below 3.5 millimole per liter is called low potassium level or hypokalemia, and if the potassium level is between 2.5 to 3 millimole per liter, then we call it moderate hypokalemia, and in this level patients would start developing some of the symptoms of low potassium level. If someone has a potassium level of less than 2.5 millimole per liter, then it's called severe hypokalemia, and at this level that person would develop severe symptoms of hypokalemia and that patient can also die. Now we would learn about some of the symptoms of low potassium level, and here I am showing you an article, and this article was written by me. I would also put the link of this article in the description box. So at first we would develop muscle weakness, and that would include our skeletal muscle, smooth muscle, and also cardiac muscle. For skeletal muscle weakness, we would develop heavy legs, fatigue, low exercise tolerance, breathing difficulty. We would be very lethargic. And for smooth muscle weakness, we would develop constipation because our intestine has its own movement. It contracts and relaxes to pass the food downward, and this special movement is known as peristalsis. If the potassium level is low, that movement also slows down. As a result, we would develop constipation, abdominal cramping, and also bloating. Cramping and twitching of the skeletal muscle is also common if someone has low potassium level, but be mindful that the skeletal muscle cramping and twitching can also be a sign of low magnesium and low calcium level. In fact, some of the signs of low potassium level also overlaps with the signs of low magnesium level. Another thing can be happen, which is known as rhabdomyolysis. It is a condition where the muscle cells really starts to break down. Similar to the muscle cells, our neurons also need potassium to generate action potential and to work together to produce thoughts. Mainly all the brain activity also depends on a normal potassium level. So if the potassium level is low, then we would develop brain fog, confusion, sluggishness of thinking, and inability to concentrate. Our cognitive ability would decline, so our situational awareness and data interpretation skill would also decline. Low potassium level can also cause hypertension or high blood pressure because potassium is a physiological relaxer. It normally relaxes our blood channels. So if the potassium level is low, the blood channels become more constricted and it increases our blood pressure. Other features of low potassium level can be alkalosis. So our pH balance becomes disrupted and becomes more alkalic. And we can also develop insomnia due to high anxiety level and racing and pacing of heart. Pulse rate also increases as a result. And pulsatile tinnitus is an interesting thing that can also happen in low potassium level, mainly due to hypertension. If this happens, then patients actually hear the pulses inside their ears. There are other causes of pulsatile tinnitus. For example, if due to some reason our internal carotid artery supplying the brain becomes narrower, then we can develop pulsatile tinnitus. Also, there is a tumor called glomus jugular tumor that can also give us this finding. The feeling of thirst and increased water work frequency are also common findings in low potassium level. Some research also mentioned about the association between low potassium level and development of dry skin and acne problem, because obviously the skin cells also require a normal potassium level to properly function. Another thing which is very important for the diabetic patients, and that is in diabetes, especially in type 2 diabetes, what happens? The insulin cannot work properly due to insulin resistance, and potassium is also needed for the insulin to work. The main function of the insulin to help the glucose to enter the cells for energy generation and also absorb glucose plus other nutrients from our gastrointestinal tract to our blood. So without potassium, insulin cannot efficiently do all these activities, leading to more insulin resistance. So for diabetic patients, if the potassium level is low, then the insulin resistance would be even higher, and the requirement for insulin from the external sources and anti-diabetic drugs would be increased. So it is absolutely important for them to have normal potassium level. Now we would learn about why we may have low potassium level. There might be many reasons, like there might be dietary deficiency. In case if someone has eating disorder like anorexia, these people tends to eat less, so they are prone to malnutrition. Also poverty may cause low potassium level, because due to poverty some of the potassium rich foods cannot be purchased, and it is particularly true for the low income countries. Alcoholism is also an important cause for low potassium level. Inability to eat due to any reason. If someone develops a tumor around the neck region, then that person may not eat properly. And in case of severely ill patients admitted to the intensive care units of the hospital, may also be unable to eat. For patients receiving total parenteral nutrition in the ICU settings, may also develop low potassium level, and sometimes too much sodium can also make our body to lose potassium, and that can also cause a low potassium level. Any sort of fluid loss from our gastrointestinal tract may cause low potassium level, and that can happen due to increased intake of laxatives, diarrhea or vomiting. Stress is an extremely important cause for low potassium level, because when we are stressed, cortisol and cortisol like hormones released in our blood, and that increases the sodium level. In turn, that also decreases the potassium level. As a result, when someone is very stressed, that person feels tired, lethargic. That person also feels palpitation, racing and pacing of heart. That patient may become anxious. That patient may develop insomnia. All of these findings are also common in low potassium level. I have talked about these symptoms just a while before. So now you can correlate the relationship between stress and low potassium level. Some medications can cause low potassium level, like diuretics, for example furosemide and hydrochlorothiazide, mannitol, theophylline, aminophylline, verapamil, amphotericin B, corticosteroids, and penicillin. Diabetics are almost always deficient in potassium, because potassium can lower insulin regulation. I discussed it just a while before. Sometimes low magnesium level can also give a low potassium level. Injury and surgery can lower potassium level by many mechanisms, because obviously these are stressful conditions. In these situations someone would develop stress, and during stress we lose potassium. Another factor can be surgery and injury may cause large amount of blood loss, so that can also give us a low potassium level. Some genetic disorders like Bartter syndrome and Gitelman syndrome, I am not going in details about these genetic disorders, but in a nutshell, these genetic disorders renders someone's kidney to be unable to reabsorb the potassium from their nephrons. Ketogenic diet can also cause low potassium levels, so sometimes it is recommended to have potassium supplements if somebody is doing strict keto diet. Sometimes high sugar diet can also cause low potassium level. Now we would learn about some of the potassium rich foods, and these are beetroot, avocado, banana, salmon, coconut water, sweet potato, spinach, tomatoes, white beans, orange juice and yogurt. Please be mindful that one single medium-sized banana contains only 400 to 450 milligrams of potassium, so that would not be enough to give your daily potassium requirement. So you need to eat a lot of these foods. If we want to increase the blood potassium level naturally, then we can focus on eating these potassium rich foods. We can get potassium supplements and we can limit alcohol and caffeine intake. But if someone has already developed one or more symptoms of low potassium level, then it is recommended to call the doctor immediately, because low potassium level can be very dangerous and life threatening, and sometimes we need to inject potassium in a clinical setting. At the end of the video, I would like to tell you that potassium level needs to be in the normal range. Anything below it is dangerous, anything above it is also dangerous. If you want to know what happens if someone has too much potassium, and the medical term for that is hyperkalemia, then please write me in the comment section. I would make a separate video on high potassium level.